Bacterial meningitis by Sheena McClure, Dana Pearson, Jamie Tullis, and Jamie White. Causes of bacterial meningitis. Newborns. Group B Streptococcus, Escherichia coli, Listeria monocytogenes. Infants and children. Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenza type B. Adolescents and young adults. Neisseria meningitis, Streptococcus pneumoniae. Older adults. Streptococcus pneumoniae, Neisseria meningitis, Listeria monocytogenes. Major characteristics of bacterial meningitis. Gram-negative bacteria include Escherichia coli, Neisseria meningitis, Haemophilus influenza type B. Gram-positive bacteria include Listeria monocytogene, Streptococcus pneumoniae. Motile bacteria include Neisseria meningitis, E. coli, Listeria monocytogene. Non-motile bacteria are Streptococcus pneumoniae, Haemophilus influenza type B. Capsulated bacterial cells would include Neisseria meningitis. No capsule includes Streptococcus pneumoniae, Haemophilus influenza type B, Listeria monocytogene, and E. coli. All gram-negative bacteria are non-acid fast. Listeria monocytogene and Streptococcus pneumoniae are acid fast. Virulence factors of bacterial meningitis. Neisseria meningitis. Antiphagocytic polysaccharide capsule. IgA protease are extracellular bacterial enzymes specific for human IgA. LOS is the highly toxic endotoxin responsible for membrane inflammation. Fimbriae enable bacteria to adhere to the host's nasopharynx epithelial cells and begin their infection. Listeria monocytogene. Gastrointestinal cells and macrophages phagocytize the organism in phagolysosome. However, the bacteria then releases endotoxins called Listeriolysin O, which destroy the phagolysosome membrane and gaining access to the cytoplasm of the host cell. Listeriolysin O actively divides in the cytoplasm, then migrates to the periphery of the cell using the polymerization of the host cell actin and pushes out the cell membranes, forming pseudopods, which are taken up by the adjacent host cells. Transmission. Some bacteria can spread through the exchange of respiratory and throat secretions such as saliva or mucus. Unlike other bacterial causes of meningitis, you can get Listeria monocytogenes by eating contaminated food. Other ways of transmission include close or long contact with a sick person in the same household or daycare center, or direct contact with a patient's oral secretions. Major signs and symptoms. Meningitis infection may show up in a person by a sudden onset of fever, headache, and a stiff neck. It will often have other symptoms such as nausea, vomiting, increased sensitivity to light or photophobia, altered mental status such as confusion. Expected outcome when disease is not treated. If left untreated, bacterial meningitis has lifelong damage such as seizures, mental impairment, and paralysis may occur. However, if immediate treatment is received, people will recover without any lifelong damage. There is a 10% death rate for bacterial meningitis if left untreated. Treatment and prevention. Treatment of bacterial meningitis includes antibiotics, corticosteroid for inflammation, replenishing fluids lost from loss of appetite, sweating, vomiting, and diarrhea. Prevention for bacterial meningitis includes avoiding sick persons, washing hands, covering mouth and nose when you cough or sneeze, and appropriate vaccines such as Neisseria meningitis, Streptococcus pneumoniae, Haemophilus influenza type B.